Hello everyone, it's Francie Millan here, Miss San Antonio USA 2024, and I'm in Austin, Texas at Westlake Plastic Surgery to meet with none other than Dr. Caridi, a world-renowned plastic surgeon for a rhinoplasty. And what better way to share this journey with me than to bring you guys along with me. With that being said, let's go.
Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please go do that now. When you do that, it helps us grow our community. It helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching.
What my expectations are, what I've wanted in the consultation, what I'm planning to achieve, right? And what I love the most was when we were talking, about the refinement. Because when it comes to, doing a cosmetic surgery, I'm very big on refining my look. I'm very confident in my look, who I am, and what I want more than anything is just refining it a little to make myself feel a little bit more comfortable and more confident. And with that being said, like, he nailed it right on the dot. He's like, I'm not trying to change your nose. I love your nose and your character. We just, we're going to refine it a little bit and make it look perfect. So yeah, I'm super duper excited. I'm currently at my pre-operation consultation. My surgery is, I'd say, 2 weeks away. Our date will be on Halloween. And I love Halloween. And fun fact, every time Halloween comes around, I always have something, whether it's a peel, whether it's something cosmetic, always comes around that poor Kevin and Marco and George have to take care of me on Halloween. Sorry, guys. But guess what? We get to do my favorite thing that I do on Halloween, which is watch Corpse Bride. So what perfect excuse to watch Corpse Bride than, be healing from a surgery. Also, I put in a special request and I asked for my cast to be pink. They said it's doable. So I'm super excited. I bought this really cute shirt, which will be on my Instagram, and it says, I'm just a girl, and it's pink. So I said in my cast, please shape it. And with that being said, I'm super excited. My number one nurse has already prepared. His name is Simon, and I know if I'm rotting, he's gonna rot with me, and yeah, he's gonna be with me at all times. That dog even goes with me to the restroom. So I know he's gonna be there for every time I need to take my medicine, every time I need anything, he's gonna be ready on deck.
So I'm gonna send you home with this folder. It's just your pre-op packet. And included in here is everything you need to know for your day of surgery, okay? So this is just your list of instructions, so basic things. So we have you scheduled for Halloween. You'll arrive at 7 a.m. Surgery won't start until 8 a.m. The important things to know before your procedure. So the night before, of course, no smoking, no alcohol, and don't take any non-prescription medications. That evening before surgery, you can eat normally. Just make sure that you are done eating by midnight. Okay, so nothing to eat or drink past midnight, of course. And then that morning of surgery, you are able to bathe and brush your teeth. Just don't swallow the water. Okay. We don't want you to have any lotions or creams on your skin when you come in, which is really hard. So no makeup or anything like that when you come in day of surgery. And when you do get dressed to come in, I know we've already talked about your pajamas or whatnot that you're gonna wear. It's nice if you have a button up.
It's button up.
You did? Okay, good. So you're all set there. And then of course, pajama pants are gonna be great because just think comfort, okay?
I actually put shorts on because I felt like it was easier to
That's good.
manage.
Yep, that's
I'm
totally fine.
trying to make your job
yes,
as easy as
we're
I
gonna
can.
be helping you get dressed, so that's perfect. And then slip-on shoes are always good.
I ordered some pumpkin slippers with Frenchies on them.
Because
I have a Frenchie.
Okay. Do you have compression socks yet?
Yes, I did.
Oh my gosh. Okay, so she's all set
and they're actually all cute too.
Okay.
I was gonna get them Halloween themed, but I was like, okay, it's a little
too much.
I
a little
love
too
Halloween,
far.
but
I do too. Okay, well great. I can't wait to see what you're wearing when you come in. And other things, of course, you can leave any jewelry, money, valuables with your brother, wherever at home, okay? And then down here is just your checklist of everything you need to have with you day of surgery, okay? So first thing is your consent forms, and I'm gonna include those in this packet so you guys can read through those and of course ask me any questions about that if you have any. And then prescriptions. I'm gonna send in some prescriptions for you today. We'll talk about that later, where you want them sent into. And of course you can pick those up before you come in day of surgery. And then a stool softener. I don't know if you had to deal with this ever in the past. Yeah, they have you get one, so you know what it's for.
Yeah.
And then we just talked about your compression socks. Typically, you'll be wearing those about 3 days usually after this, because you're up and mobile after surgery. So the reason you wear compression socks is to help prevent blood clots from forming. It's a short surgery, so we're not worried about that really, but you gotta do it. Okay, and then saline nasal spray. Okay, this will be your best friend.
I was about to say that. I've heard
yes.
It's your bestie.
Yeah, it is, because you can't blow your nose initially, and that's pretty difficult. So saline nasal spray, you can use as much as you want because it's just saline. And so that's gonna make you feel like there's some moisture in your nose, because it feels very dry afterwards, okay? And then I also put on here to get some Afrin, because Afrin's really good decongestant, and that helps a lot too. Side note on this is that it's also nice to have a humidifier in your room.
I've actually heard that.
Yeah, that's a nice little thing. You don't have to have it, of course, but it is good to have. And then afterwards, you'll also want to take like really hot showers, steamy showers.
I take boiling hot showers.
Well, you'll do just fine. You'll do just fine. And then we've talked a lot about ice packs, and I would say that's probably the best advice we can give you as far as your recovery, is to have a lot of ice packs available. So something I learned over the years through my patients is to have frozen peas. And you can just kind of divvy them up into little Ziplocs, and then just kind of change them out as you go, because it'll only stay cold for about 20 minutes, and then you can get a new pack of frozen
peas. The funny thing is, I saw it on the email and I was like, frozen peas. That's an interesting.
Yeah, so it makes sense though, because peas, they're kind of pliable because they're small. It's not like big chunks of ice, and so people tend to like that better. So it's a good tidbit. Okay, and then this one's kind of funny too. Trim your nasal hairs before surgery. If you don't do a good job, we'll do it for you. Okay,
perfect. I was like, how do I?
Yeah. Don't worry about it. We'll do it when we get back there. Okay. And really, that's everything you need to know. Other little things, like Dr. Creed was talking to you earlier about sleeping elevated for the first few nights. That really helps with swelling and bruising if you don't lay flat for the first few nights. And of course the ice. And so that's it. And you'll have packing for a day. I'm going to tell you guys how to take that out. I'll show you a video of me doing that. That'll be fun. And yeah, after the packing comes out, 1 day post-op, it all just feels better. Yeah, you'll feel like a new person. And then at 7 days post-op, we'll take off your splint. We're looking for the pink splint.
I requested a pink one.
Yes, we have a special request, pink splint. I have Michelle working on it right now, so we'll see. And then after 7 days, and you and I kind of discussed this a little bit too, but lots of bruising still, swelling, and it takes 2 years for the nose to fully be healed, and so it's changing throughout that time.
Now, I have actually a really good question. When can I be able to work out after the surgery?
Very good question. Okay, so 2 weeks. I would give yourself 2 weeks. That being said, I wouldn't go to yoga, where you're bending over, lots of pressure there. But you can do cardio, you can be on a treadmill, you can do elliptical, you can lift weights.
You hear that, Dom? I can lift weights in 2 weeks.
Oh, here she comes. She'll be back before you know it. So 2 weeks is a good time to just allow your body to heal. Also, something I'm going to give you a form on is arnica and bromelain. I don't know if you took that previously.
I heard that they're
Love
really good for
arnica and bromelain to help with the bruising and swelling. There's even arnica cream that's really nice to have, and you can apply that as much as you want to the bruising. So the eyes is what bruises. I know you've watched the videos, but it's almost like black eyes, right? I hope that doesn't happen, but at least you have pretty colored eyes that'll look like beautiful makeup.
It's Halloween, luckily. No.
Yeah, exactly.
But in all seriousness, what do you think about pineapple juice? 'Cause I heard.
Yeah, okay, so bromelain is a pineapple extract. So lots of people believe it,
Can I start drinking it before?
Yeah.
Because some people are like, you can, some people are like, you don't.
Yeah.
To consider a blood thinner too.
Yeah, you can drink pineapple juice. It's not gonna. Yeah, I don't want you taking the arnica before.
No.
Yeah,
I know you can't take any medication whatsoever.
Yeah.
Right after.
Yeah, arnica has a slight blood thinning quality, so we want to hold off on that until afterwards. In fact, you won't start that until the day after surgery.
And then I'm gonna mention this for the video because a lot of people do suffer with this. I actually mentioned my nausea. because I get very nauseous.
Yeah.
And like you said, I
Yes.
think you're
So we are going to treat that. I'm going to use what's called a scopolamine patch, and that will just go behind your ear. And you'll have that for about 3 days.
Oh, perfect.
And so that some people have had those on cruise ships and things like that. They're really nice to have. And then, of course, we'll treat with Zofran as well. It's just an anti-nausea medication. I'm going to send you home with a prescription for that, just in case. And then Dr. Wilson, our anesthesiologist, will be treating through your IV during surgery. So you'll be ready. We can handle it. We are lucky we don't usually deal with nausea here because we do all these things to make sure that you don't.
I mean, it's in the IV, it's in the
medication.
it's in the patch. Like,
We're treating
good to go.
all the receptors that cause nausea.
I'm going to be good to go. And a good night's sleep because nausea medicine just puts you to sleep.
Yeah, you'll be sleepy that day for sure. So, but surprisingly enough, this surgery is not super painful. I know we've mentioned that in other videos, but it'll feel kind of like the congestion is what's most annoying. But as far as pain, it's just overall soreness. Some people get a headache afterwards a little bit, but that dissipates in the first day. And I even have patients that don't ever take the pain medication.
I've heard that. I've actually seen videos where some girls are like, I took the pain med the first day, and the second, third, fourth, I was pretty much good to go.
Absolutely. They do really good with
I've heard everybody heals different. So
it's
that's
true.
why they're joining me on my journey on how it.
Yes, and I always say expect the worst, and I know that sounds kind of weird, but if you are one of those people who's like, oh, I'm not going to get bruised at all, I don't even have to think about it or worry about it, and then you wake up and you're bruised, it's like a bummer, right? But if you're kind of expecting the worst, it's all easier to take
I'm already
on.
black and blue.
Yeah, just plan for it.
I'm already like, Marco, what kind of full coverage foundation are we going to
Yes.
because we're going to do that.
You're so lucky to have your in-home makeup artist with you. Okay, so this is just information. They just highlighted where to get the compression socks, which you already know. You already have those. This is information on the arnica and bromelain. I don't care if you get these exact dosage amounts, just grab some and read the bottle, right? So, and then all your consent forms are here, and I'm gonna make a couple of copies, and then I'll put it in this packet, and it'll be ready to go for you. Okay. Any questions that you can think of right now?
I do know. I think when you do, and I don't know if this is true. You can correct me if I'm wrong. Sometimes it's good first day to eat kind of like soft food.
Yes.
Because it's going to be a little hard to move.
You're right. Yeah. So it's just hard because your nose is clogged, right, on purpose, and so it's hard to breathe, right? So you have to breathe through your mouth, and if you're taking a big bite of a cheeseburger or something, your mouth is busy for a while. So mashed potatoes are good because then you can breathe through your mouth.
You know, like for myself, I have my mom already make my favorite soup, so that's gonna be my first day meal.
Yes, don't forget to eat some sort of carbs though when you take your pain medication, if you take your pain medication, because pain medication can cause nausea, and so you want to have like bread or crackers or tortillas or whatever you want, but have something else just besides soup. Okay. Okay, well good. We're looking forward to it.
Like, smile. Thank you. I love this.
Okay, so here we are, ladies and gentlemen, and we are discussing a rhinoplasty, something that we had sort of discussed a little bit before. And so, needless to say, we have a pretty impressive looking young lady.
Thank you.
By any stretch of the imagination, who has, by the way, a very good nose as well. She has a beautiful nose. And so what we were discussing and what you were wishing, well, she actually came to me in part because she thinks that, well, she knows my work. And I'm all about natural noses and working with what sort of God gave you in terms of just refining it. So if I look at her, she's just, beautiful, petite features, just like the quintessential doesn't get better. But we see a little bit of fullness on the dorsum of her nose and a little bit more in the tip than ideal and a little bit wide at the base of the nose. So that's an area that we discussed, and we're like, well, if we just combine improvements in those three areas, we think that's going to make a huge difference and you're going to be a happy camper, right?
Absolutely.
Right. And the breathing is good, which is a wonderful thing. And we talked about recovery, how long it takes, which is really not that much.
Not that much, yeah.
Yeah, it's not that much. And we talked about ice.
And trusting the process, because it does what I've learned and what I've heard from you guys giving me the advice. It's, you're not going to see your real nose until about 2 years. So trust the process.
Yeah, well, you're going to see your nose when we unveil it, which will be cool because this will be on camera as well. So to me, it's called the big unveiling. So no pressure, obviously. But, you know, in my mind, I've already done the procedure, and between narrowing of the base of the nose, a slight hump reduction, and a small refinement of the tip, I believe the nose will come into a much, even a better balance and a better proportion, and it's going to be breathtaking.
Ooh.
Yeah, breathtaking, because she's beautiful to begin with. So, I mean, how can I go wrong when you think about this? So it's just going to make a beautiful individual even cooler. So what say you? What do you think?
Oh, I'm excited. I was actually letting them know you weren't here to listen to this, but I'm actually a huge fan of your YouTube videos. And I was talking about the cracking and the thinning and the filing. So I'm so excited to see after, all that, how it happens, especially because I heard that there's a certain part that you do as soon as the bone cracks. You kind of hold it together, you let the swelling go a little bit away, and you let it go, and it's there.
Yeah.
So I cannot wait to see the process. That's my favorite part, the process.
So it's actually kind of setting the stage for a really kind of cool, you're going to see how we do it, right? And then you're going to see the unveiling. So again, no pressure, but think about how cool this is going to be in terms of educational content, which I know you're all about. So this isn't about like how wonderful either of us are. It's about what two individuals can do to sort of make improvements that are done safely, reliably, and consistently.
And help others realize, it's a process, and it's completely okay. If you want to feel a little bit more confident, more comfortable, make sure you do your research and you go with someone like yourself that's very professional, knows what they're doing, and at the same time is going to deliver results that, are realistic. Because I think that's what a lot of people fall prey to. And that's what I loved about your practice. You were very about refinement and keeping, your charm, not taking it away. Instead making it look a little bit more like yourself and beautiful. So that's what I'm the most excited about.
The nose that no one will know, right? When I say that, we always talk about that when people do noses, and it's like it's obvious when things are kind of weird and it's like upturned or super sloped and all that kind of stuff. We're trying to make a nose that just is complementary, works with your face beautifully and all that kind of stuff. So I'm excited personally.
And then after, hopefully I can take a ride on the Vespa.
See, we shouldn't have posted this Vespa thing, It's like,
Oh my gosh, now she's...
I know, it's like it's people rubbing in this whole thing Vespa. Now, look, you need to wear helmets, and you're not riding on the highway, that's for darn sure.
But
But
hashtag photo shoot on the Vespa.
yeah. I do believe in a photo shoot on the Vespa, I will tell you that. Because it'll be like, okay, just turn to the side. Frontal view, lean a little bit this way, that kind of stuff. So
Be the mascot.
yeah, it's super exciting. The Vespa nose. How about that? Exciting.
It's gonna be exciting. And
It
then
is.
The thing about me, I'm like, y'all just do it. I trust
Yeah, she does. It makes it a lot easier for me. I mean, she knows my work. I know you know, and I know my work, and I'm confident that we're able to kind of pull this off really nicely. And like I said, no pressure because she's such a high roller, and all that kind of stuff.
I wish, guys.
Yeah, no, she's such a high roller. And for all of you out there that think that she's got a bad nose to begin with, no, this is a good nose.
Thank you.
It's a beautiful nose, and so I'm changing it just because we can, and we can do it reliably.
Exactly.
And it's still going to be her. I'm not going to make her look like somebody else. That kind of stuff. What's your biggest fear?
The not being able to breathe and letting nature take
Oh God, she already told me that. So there is some packing in that's not packing. It's these little, oh my God, like cigarette things in your nose that absorb
the blood.
a little bit, yeah. And then you can pull it out the next morning and off you go to the races. You'll be a little stuffy, but it'll just get better with
That's
time.
really my biggest worry. I saw the shaving videos, I saw the cracking, and I'm like, oh, I'm not scared of that.
Well, the good thing about mouth breathers, in a way, or nose breathers, is that your body will automatically convert. So as soon as you wake up and you take your big breathing through your nose, it'll automatically go to your mouth, so you'll be fine.
That's perfect. That genuinely was my only worry. After seeing your work, I'm like, there's really nothing else I'm worried about.